The following is the Optic View, a production series of Clear Vision Eye Center. Let's see the world with a clear vision.
Good evening, everyone, and welcome to our very first episode of the Optic View. I am your host, Nakita Braveboy, and it is truly a pleasure to have you join us for this very new and exciting program brought to you by Clear Vision Eye Center. Let's see the world with a clear vision. Through the Optic View, we aim to enlighten and empower our community with valuable knowledge about eye health. We will be exploring various eye conditions, understanding their risk factors, and discussing the latest treatments available to protect one of the most precious senses, our vision. Please sit back, relax, and join us as we venture into all of our panelists here with me today to the new and improved Optic View. We would see you. We'll be right back.
We now return to the Optic View, a production series of Clear Vision Eye Center. Let's see the world with a clear vision.
Welcome back. I am your host, Nakita Braveboy, and this is the Optic View. Our very first discussion will be the topic glaucoma. Theory states that it is a very serious eye condition that can lead to irreversible vision. It is one of the leading causes of blindness worldwide, and early detection is the key to prevent sight. Today, we will be shedding light on what glaucoma is, its causes, risk factors, and the various treatments options available right here in Grenada. To help us navigate this important discussion, I am honored to be joined by three esteemed guests. First, we have Dr. Nathanya Julien, a dedicated ophthalmologist who will provide expert insight into glaucoma, diagnosis, and treatment. Next, we welcome Dr. Ryan Singh, a skilled optometrist who will seek the importance of early detection and routine eye care. Finally, we have Ms. Astra Dubissette, a knowledgeable health psychologist who will discuss the psychological effects of vision loss and how patients can cope with glaucoma diagnosis here in Grenada. Ladies and gentlemen, we welcome all the panelists here this evening, and of course, we are going to give you an insight fully on glaucoma. Dr. Julien, welcome to the Optic View.
Thank
How
you,
are you
Nakita.
this evening?
I'm fine, thank you. And you?
I am good, thank you.
Thank you for having me.
Thank you for coming. Dr. Julien, for the viewers home and abroad, can you give us an understanding of glaucoma? For persons who, first time they probably be hearing the condition, most of them tend to be ambiguous about it and probably confuse it with cataract. So in your understanding, and given that you have a lot of theoretical aspect in glaucoma and of course, treatment and so on, can you explain what is glaucoma and why it is often referred to as the thief of sight?
Okay, so glaucoma is referred to a disease of the optic nerve. So in simpler terms, there is a problem with the nerve at the back of the eye. And that nerve is what takes the information to the brain to allow us to see. So when we have a problem in terms of the drainage system in our eyes, that's the primary target of the pathogenesis behind glaucoma. So the eye is responsible for making its own fluid, which is from the ciliary body, and it has a system in which it drains that fluid. It passes into a drainage system called the trabecular meshwork, goes through the canal of Schlemm, and it leaves the eye through its various vessels. So when there is an imbalance between the amount of fluid the eye makes and its ability to drain, that's when it becomes a problem in terms of a raise in the intraocular pressure. So in other words, the fluid is trapped, is not able to drain adequately, and the pressure builds up in the eye, leading to, consequently, high pressure damaging the optic nerve. How does that affect one? It starts to affect your peripheral vision first. So that is why glaucoma is called the silent theft of sight, because it takes away your outer vision first without you having any symptoms or sign.
Right. Well, that is an excellent explanation, Dr. Julien, and I really appreciate you for that. But you made mention to high eye pressure. Is that linked to body pressure, or is it a distinction? Is it different?
Yes. So it's a clear distinction between what is your systemic blood pressure and your eye pressure. So your ocular pressure is a already closed off system in terms of making the fluid, draining the fluid, and that imbalance there created by the high intraocular pressure. So what is high? So we term normal pressure between the values of 10 to 21. Most literature would have that limit. And then there is a special variant of glaucoma whereby persons are most sensitive to that normal lower ranges. So we even see that if the pressure is 18 or 19, which is still within acceptable limit, but when we observe the optic nerve, we see there is progressive damage, and there is changes in the visual field. So when you have losses in the visual field as well as damage to the nerve, then that variant shows that that person needs to have better control of their intraocular pressure.
Well, there you have it, Dr. Julien, and I really appreciate that explanation in terms of the progression and so on. So which leads to my second question. What are the different types of glaucoma? And if such, how are they different in terms of symptoms and progression?
Okay, so there are mainly two main categories of types of glaucoma. So we have namely the open angle glaucoma or primary open angle glaucoma, whereby seemingly the drainage angle on examination is open, but yet still there is a defect in terms of the mechanical drainage system. In that case, most times the patient is asymptomatic. So you have no eye pain, you tend to have no symptoms until it is much later on. When the patient first starts to notice there is blurred vision, maybe a little discomfort at the level of the eye, they might have a little stabbing sensation in the eye now and then. And then there's a variant of the closed angle or narrow angle glaucoma, in which the drainage system or the angle at which the drainage is much narrower. And the position of the iris plays a very important role there, whereby the iris causing some level of obstruction to the angle, narrowing it a bit, and therefore causing the pressure to become elevated in the eye.
In the eye. Well, that's an excellent explanation again, Dr. Julien, and we truly appreciate you for that. But before I go into my further questions, is glaucoma really hereditary? Possibly I may be jumping into a question that I may ask you later on, but in terms of glaucoma diagnosis so far, have you seen it in your younger population, or have you seen it in the older population? Just before we
continue. So there's a wide range of different types. Here on Ireland, we have the majority is open angle glaucoma, or primary open angle glaucoma. But we do see the variants in children, which we call congenital glaucoma. So it's a very It's a very concerning pathology whereby we notice that the children are born with this deformity. So their drainage network is not functional from birth, and therefore the eyes would be sometimes a little larger than normal. You can have clouding of the cornea, might be a bit edematous. You might see some lines or some breaks in the cornea, as well as you may have ocular redness, sensitivity to the light, and sometimes tearing. So if a mother is very observant, since birth, she may be able to pick up these abnormalities, or maybe a little later on, 6 weeks old, 1 month, 2 month old, you may notice some changes on the surface of the eye. And that's why it's very important to then take the child in to get examined by an ophthalmologist or an optometrist to be able to screen that child properly and therefore take the necessary steps, which is in that case surgical, to be able to repair the defect, have the surgery so that the child can develop normal vision. Because we see it sometimes when you don't intervene, then it turns into something very, very, very difficult to manage, as well as the vision loss becomes irreversible. And this is what you want to do, prevent blindness. So it's very important to recognize these early changes, not only in the adult population, but also in the pediatric population.
In the pediatric. Well, there you go. Thank you so much, Dr. Julien. And now that we understand glaucoma in its basic terms, and of course understanding the diagnosis, and possibly not knowing that it's not only for the older persons that we say in the community, but it can also affect the fetus and of course children growing. Mm-hmm. So now we understand that. What are some new advancements in terms of treatment? And it's going to lead me to this question. What are some of the most recent advancements in glaucoma treatment? And are there any promising therapies or technology on the horizon?
Okay, so this is a very exciting time for glaucoma. So in the recent symposium held in February in 2025, at an event in San Francisco, USA. It was the highlight of it centered around reimagining glaucoma treatment and new drug delivery systems. So traditionally, we all know that glaucoma is treated by eye drops, right? So there's the medical treatment, then there's the surgical treatment. So the medical treatment, we know we use our eye drops in the different categories. We have beta blockers like timolol and your betoxolol. You have alphagan, you have brimonidine, you have brinzolamide, and then we have the group of the prostaglandins, things like bimatoprost and latanoprost. So traditionally, the patients who obtain optimum control of the intraocular pressure, that is a good start point for them. So now there are combination therapies whereby it aids compliance. In one drop, we have 2 medications. So the patient, instead of having to worry about using 2 different bottles, they concentrate on just ensuring that they put that combination drop, and that even is more effective in lowering down the intraocular pressure because it's better compliance, right? So in terms of the newer modalities of treatment, you have the laser therapies, which is the trabeculoplasty, whereby a laser makes an opening to improve the drainage of the fluid that becomes blocked. There is iridotomy, which is laser, is also another procedure done. There's SLT, trabeculoplasty. There is also trabeculectomy, which is a filtration flap that is placed during the surgery in an operating theater to create a better drainage system underneath the conjunctiva. And then we have the implants of intraocular devices like the iStent, like the Zen. So these implants improve the pumping ability and drainage. In other words, all aim to lower the intraocular pressure. And there is the placement of valves. So the intraocular valves, just like the Ahmed valve, is used to make an insertion so that it pumps fluid from the anterior chamber underneath the conjunctiva to help the intraocular pressure to be lowered. And most recently and most exciting is the use of intraocular lenses that are loaded with medication, meaning that you can do a surgery to remove your cataract and you also have glaucoma, and that lens is inserted, is preloaded with medication. So that same dose of latanoprost or bimatoprost is slowly secreted into the eye to lower the intraocular pressure, and that can last for sometime up to 3 years. So this is very new and exciting, and it shows you that there are many modalities of treatment out there. And with regards to neuroprotective drugs, which is on new, we look at one is controlling the intraocular pressure, but another could be on using drugs that is, or supplements that helps the optic nerve. In other words, neuroprotection. So these medications are really coming on stream, things like coenzyme Q10, the use of ginkgo biloba, which has been shown to improve the visual field results in patients with glaucoma. Right. So there are many studies out there which are quite promising and new. So we are happy to share that information.
I am even more excited for persons who are viewing, and even for most of your patients who, you obviously do a lot of treatment with. And I am pretty much, I like the latter part. You said that it's something where you implant a lens. It's a lens, right? Mm-hmm. So when you do the cataract surgery, and if so you are to have glaucoma as well, this new lens could be placed into your eyes, and of course it can secrete the necessary eye drop, per time. So it's basically measured, I assume. Yes. But that's technology. That is what you call advancement in technology. And Dr. Julien, please, for persons home and abroad, how soon do you think this could be here in Grenada? Do you think it's something that we can consider in introducing that into our eye clinic?
So it's on stream, and it's currently in phase 2 trials right there in the US. And they have been promising results whereby they have done clinical trials in the stage phase 1, yes, which shows that the effect is lowered and that the patients can come off their eye drops and even stay for longer periods. And we all know the eye drops are very costly. Yes. So it's a very good advancement whereby you resolve 2 problems at one. You remove your cataract as well as you get treatment for your glaucoma. In time, as it becomes FDA approved and it's then on the market, it then would be, of course, become something available that we can incorporate into our healthcare system.
Great. And in terms of, in terms of the pharmacology world and aspect, everyday new drugs are being, introduced into our market. So my question to you again, Dr. Julien, before we go into a short break, I would like to know, are there any new drugs, but you already explained the devices, so, mm-hmm, but are there any new drugs being developed to improve the administration and effectiveness of glaucoma medicine?
Yes, so with regards to the spot glass trials that is on stream, that focuses on the preloaded doses. There are also implants that are being developed whereby you put an implant in the area of the angles and they can improve the delivery of drugs. Mm-hmm. There is also implants for the monitoring of the intraocular pressure, yes, whereby through Bluetooth device, the ophthalmologist can monitor on a daily basis throughout the day what your IOP readings are, and it can alert you when your intraocular pressure becomes raised. So the new treatment plus the new devices puts a very promising avenue there and many treatment options for persons with glaucoma. So sometimes we were of the mindset that once you say glaucoma, it means instant blindness. Yes. But there are many treatment options available, and of course compliance to treatment and understanding what you have and changing the lifestyle and changing what you eat, try to have a healthier diet, and including a lot of the change is necessary. Persons can live for long and healthy lives to be able to and still have their life, still have their sight.
Well, there you have it, ladies and gentlemen, your first episode of the Optic View, and Dr. Julien heading the first segment, explaining exactly what glaucoma is, the effectiveness of using the drug, and of course compliance, right, Dr. Julien? Compliance to the medicine and so on. It's no longer the thief of sight. We can actually treat it better, and then you can see better once you have the right doctors. Ladies and gentlemen, we're going to take a short break, and we will be right back at the Optic View.
We now return to the Optic View, a production series of Clear Vision Eye Center. Let's see the world with a clear vision.
Welcome back again, ladies and gentlemen, to the Optic View, hosted by yours truly, Nakita Braveboy, and brought to you by Clear Vision Eye Center. Today, I have the opportunity of speaking with Dr. Julien, our ophthalmologist, Dr. Ryan Singh, our optometrist, and Miss Astra Dubissette, our health psychologist. So we're going to continue this segment. Dr. Singh, how are you doing today?
I'm good. How are you doing? You good?
I am good, thanks. So Dr. Julien, give us an insight on glaucoma and basically explaining glaucoma in terms of what it is, its treatments, the new advancements in technology, and so on. But as an optometrist, what do you look for in your routine eye check with your customers?
Okay, nice. Well, basically we are looking for what we call a normal fundus. And to understand that, a fundus is basically like the inner lining of the eye. And your fundus, as Dr. Julien was speaking, has the optic nerve. It also has what they call the macula. So you could think about it like this room, the switch to the light, right? The connection between the switch and the light needs to work properly. With glaucoma, the connection between that nerve and the segments in the brain needs to work properly so we could see good, all right? So all I am looking for and all I am concerned to see is an optic nerve that doesn't look normal, all right? So what does a normal optic nerve look like? Let's say you have this cup and you put a plastic bag on top of it. You just rest it flat there. That seems normal to me. But if you apply some pressure, because if you remember what she said, she spoke about, especially in Grenada, one of the main causes of glaucoma is open angle glaucoma caused by high intraocular pressure, okay? So we're looking at that. That plastic bag there, you get some pressure on it and it goes inside. If I see something like this, I am concerned. Then I need to think immediately, look, Dr. Julien, she sees a lot of this. I see a lot of normal fundus. So I would prefer to send these things for her to deal with, okay?
Right,
yeah.
And that you shed some light, and that is so true. So for most of the optometrists listening now, so like you said, a normal fundus is what you look for in terms of a comprehensive eye examination, right? And it's not just reading the Snellen chart and so on, but you must do a fundus photo testing or an OCT. So what are some of the things that you can look for, or can you just see it with the naked eye, as we say in Creole language?
Well, you would need some sort of device,
yes,
especially with a light.
Okay.
So traditional device is what we call an ophthalmoscope.
Right.
It's basically like a fancy flashlight with a way to look inside of the eyes, with a lens that we can magnify the eyes, all right? And with this, we can basically just look at the nerve. We used to use this early 1960s. More recently, you have what you call like a Vogue lens. You can put it up to the what you call a slit lamp. It's like a microscope.
Right.
We have it in all clear vision branches. So we basically look at the eye under a microscope. We also put a lens to open the view better. So this is another way we could look at the nerve.
Right.
However, way more recently, as you spoke about the OCT, it's a machine that analyzes different layers in the eye. So I don't know if they will see this, but if you look at this coaster, all right, you look at it from this point of view, it looks blue, all right? However, if you look at it from this angle, you would see that it's also white on the side. And this is important when we look at glaucoma, because we can see something pushing down from this point of view. But when we do cross sections of it, which the OCT can do, we can see damage way before the naked eye can see it, even with the machines we use. So it's good to use all methods to diagnose and treat glaucoma. You know, as Dr. Julien said, it's way more than just the nerve pathology. It's also the drainage system of the eyes. And it's important that people have knowledge of it, have knowledge of the treatments they use for it. So, you know, this is a good segment we're doing.
Excellent. And thank you, Dr. Ryan Singh, for that explanation. But of course, at Clear Vision Eye Center, we do a comprehensive eye examination to all of our customers who come in. So Dr. Singh, sorry, do you think that we should always do an OCT on a patient before he or she come to you to do a refraction report? Shed some light.
I definitely believe so. The only concern, of course, with the OCT will be it's that primarily it's been used as an ancillary test. It's a test that we usually do if we notice something wrong. So one could debate, you know, why do an OCT on a normal eye?
Right.
However, if you want to, you know, dot your I's, cross your T, glaucoma is a progressive change in the nerve, meaning it must start from normal.
Right.
So let's say everyone can get an OCT, you know, it would be more beneficial than not doing it. Because especially she spoke about congenital glaucoma, all right? Getting an OCT done at an early age would be so crucial to diagnose glaucoma at a later age as well. Okay, so regardless of the congenital, let's say someone may develop open angle glaucoma after they cross the age of 40. They come in to see the optometrist, and we look at a nerve that it looks suspicious. So it's not pushed down all the way, it just seems to have like maybe just a little impression. And you ask yourself, was it like this before? Now, if you have an OCT, which is like a picture, a scan that analyzes the nerve, you have something to compare it with.
Right.
And then you could actually really diagnose glaucoma at a really early stage.
At a really early
Yes,
stage. Well, that is excellent technology indeed, and even advancement. So, Dr. Singh, tell me a little bit, maybe if you can answer, we can probably ask Dr. Julien to just shed some light a little bit on that. But in terms of glaucoma and genes, this question is, how much of a role do genetics play in the development of glaucoma, and are there any specific genes associated with the risk of, you know, acquiring the disease or obtaining the disease?
Okay, so, you know, when we speak about genes and genetics, you know, we could probably just give people an idea what these things mean, you know?
Yes.
Genes is basically like your carpenters, your masons, and your bricks together.
Right.
So it's basically proteins in your body that builds up different structures.
Yes,
okay?
please.
So let's say you mix sand and you mix water and cement,
Right.
you get mortar, right?
Yes, please.
You use that to do one part, okay? Let's say you mix sand and gravel and cement, you get your cement for your foundation. Same thing with your genes. So different genes, the way they are arranged and the way they interact, they form different parts of the body, okay? So different genes that made up of same material could come together and form your skin.
Right.
All right? Different genes will form the genes in your eyes, whatsoever. So definitely, without even looking at research, you know, you could naturally not assume, know that genes will affect any eye condition. It
Great.
can, okay? Specifically for glaucoma, all right, we know that there are certain genes studying right now that has been associated with it, okay? If I have to think, there's a gene called cytochrome P450B1, okay? That gene was responsible for breaking down like lipids and fats, different structures in the eyes. So they realized that a lot of people with especially open angle glaucoma and various amounts of cancers, they had this gene in common. Not everyone had it, but it was significant among those people, okay? That's one gene. There's a protein in the eye called myocilin. Myocilin is very important, like for structure, okay? You're thinking about genes, you're thinking different structure, different materials, okay? So you have a different material here in the eyes that's responsible for maybe opening up what you call the drainage system, keeping the drainage system nice and open, okay? If this gene now maybe has some mutation, it could affect that drainage system. You have different genes, like there's a condition called Axenfeld-Rieger's anomaly. That's usually a defect in, I think, FOC1 gene or something like that. This gene now usually causes some malfunction, especially in the anterior segment of the eyes. This can cause disruption with the drainage, since the drainage system is close to the iris. It have a lot of genes. It have, I think, about 20,000 genes in the human body. So it have a lot of genes to be studied. Focusing on genes would be a good way to get early diagnosis. That would be something to really look into. So
pretty much you're saying that gene study would be something that we should possibly look into as a part of understanding glaucoma. And of course, just for the viewers home and abroad again, to know that we are hopefully soon about to embark on doing a glaucoma research here in Grenada. And of course, we're not going to get into the aspect of gene, but we're going to see, the amount of persons who are, susceptible to the disease, and of course, who do have it right here in our homeland, Grenada, Carriacou, and Petite Martinique. Dr. Julien, I'm going to pitch you this other question in relation to the gene, but in terms of genetics. Give me a little bit of knowledge there on the genetics aspect of glaucoma. And of course, we can speak race, if so be it. I mean, in the intimate country as Grenada, we do not have a vast majority of, race here, but it's prominently black. But forgive me if I'm incorrect. But please shed some light in terms of genetics and, of course, race in relation to glaucoma and its diagnosis.
Okay, so to zoom in on most recent studies, there is a cohort study that was done by the Ancestry Genetic Program that was in Michigan recently. So what they found was that there is clearly disparities in terms of race and, of course, socioeconomic conditions. And the study focused on primarily of African ancestry. So coming back to what Dr. Singh has stated, they had isolated over 1,110 genes responsible for increasing the risk of glaucoma, and namely primary open-angle glaucoma. So basically they found that the persons, we were passing it down from generation to generation, and there's no way we can get away from it. So the genes and the genetic makeup for which we inherited from our forefathers, meaning that if your grandmother had glaucoma, or your father, or your first-line relative, it's very important that you get yourself screened. That's what it translates, because there are things in your genetic makeup that puts you at a higher risk. And of course, once you cross that 40 mark, and of course for the population 60 and older, then it becomes a problem, right? So the study focused on trying to find those groups which were more at risk, and trying to do all the screening programs, trying to get them treatment, of course trying to gain compliance with it. So the studies are there to clearly show that genes play a very important role in the pathogenesis of glaucoma. So another important one was mitochondrial DNA, which they found that it passes on very, very strongly. It's a dominant trait that is passed along in the genes. And that looking at not only the treatment of the intraocular pressure, but gene therapy that focus in on neuroprotection. So we go back to the same, that neuroprotective component, trying to see how, besides lowering the intraocular pressure, that's one way, but there's another way that we're focusing now with gene therapy to try to reduce the effect of the damage caused by oxidative stress associated with the pathogenesis of glaucoma. Meaning at patients who had passed, when you examine the optic nerve, they found that there were buildup of compounds within the head of the optic nerve, right? So it's called RHO, which is Rho anhydrase. So if we target these coenzymes, we can try to modify gene therapy so that you are able to have less of that effect. So there are compounds that are being studied, drugs that are being studied, targeting neuroprotection through gene therapy to help decrease the prevalence of glaucoma. And recently there is an interesting study that tries to link GLA-1 receptor agonists, things like Ozempic and so, or semaglutide, that linked with diabetes. So there's a very strong correlation between diabetes, high risk factors for glaucoma, as well as high blood pressure. So you had asked me a question previously with respect to the intraocular pressure and the systemic pressure. Is it the same thing? No, it's not. Is it related? Yes, it is. Because there is clear indication that having glaucoma and having high blood pressure causes further thinning of the retinal nerve fiber layer. It is studied through OCT exams, through cohort studies that prove that by lowering your blood pressure, you are able to have better control of your intraocular pressure, because that blood flow to the head of the optic nerve is improved when you have less peripheral resistance. In other words, treat your blood pressure, and that can help you in your progression with glaucoma. Slow down the rate of progression, and therefore you can conserve your sight for longer periods.
Well, that is an excellent explanation again, Dr. Julien. But we're going to go on a tangent for a bit, because you just shed some light, and I'm sure persons viewing, once they heard, high blood pressure and glaucoma, of course, they're going to think that it's a correlation, but you obviously said it's pretty much linked, but it's not the same thing. So please, Dr. Julien, in terms of blood pressure and medication and how do you think persons can possibly pair the two in relation to glaucoma? So what are you saying? Persons who are hypertensive, they have a high rate of developing glaucoma. Is it that? Or is it that if you have, okay, let me see if I can rephrase it for you. If you have hypertension, is it the probability would be for you to get glaucoma, or is it the other way around? Explain that for me.
So to clarify, we're talking about persons who are been diagnosed with glaucoma. So you have glaucoma, and you also have uncontrolled high blood pressure.
Right.
So there is a direct correlation. So I am a patient, I have glaucoma, but I also have high blood pressure.
Right.
My blood pressure is 180 over 106. I have no symptoms.
Right.
And I'm walking around with this pressure, and I've noticed that I'm kind of losing sight as time goes by, because there are studies that prove that high blood pressure damages a layer in the eye called the retinal nerve fiber layer. So that is where the OCT screening comes in very important, so that it has been proven that you controlling your blood pressure, changing your diet, lowering your sodium intake, eating a lot of healthy fruits and vegetables, get your potassium in a good balance, exercising, trying to lose weight, you gaining that balance have shown that a drastic improvement in intraocular pressure in many of the patients. So that's why we emphasize not only on focusing on your eye for the treatment of the glaucoma, but a systemic approach is needed. Control your weight, control your high blood pressure, and control your diabetes. So once you do a systemic control, then it improves your rate. It slows the rate of progression, in other words, caused by glaucoma.
Great. Well, Dr. Julien, I really appreciate you explaining that. And of course, you giving our viewers a little hint of what we are about to talk to very soon with our health psychologist, Miss Astra Dubissette, in terms of coping with glaucoma and of course eating the right foods and making sure that you seek therapy for such a disease and living with it in terms of making sure that you take your medicines or your eye drops on time and so on. But you also made mention just before we go to a break about our NFL, and so from an ophthalmologist perspective, if it is damaged, that means the person has glaucoma, correct?
Yes, usually we see that the thinning, progressive thinning,
right,
with the effect of from the effect of the high intraocular pressure, that thinning, in other words, it eats away at the lining of the retinal nerve fiber layer.
Right.
And that's the compounded effect of untreated glaucoma. And that progressively leads to blindness if it's not treated. And blindness from glaucoma is irreversible. It does not come back.
It does not come back.
Right? So it's very different from cataracts. Cataracts, yes, is reversible. Once you have a healthy retina, a healthy optic nerve, cataract is reversible. But glaucoma, unfortunately, there is no going back from the damage. So that's why it's important prevention, screening, early treatment and diagnosis, and of course compliance with treatment to keep your vision as long as possible.
Thank you. So there you have it, viewers. Dr. Julien explaining the thief of sight, glaucoma. Of course, I am your host, Nakita Braveboy, and we'll be back shortly.
We now return to the Optic View, a production series of Clear Vision Eye Center. Let's see the world with a clear vision.
Welcome back again, ladies and gentlemen, to the Optic View. And this is our final segment. Of course, we have been speaking on glaucoma, the thief of sight. And with me, I have the Dr. Nathanya Julien, I have Dr. Ryan Singh, and of course, Miss Astra Dubissette, a health psychologist. So you have heard what glaucoma was or is, the treatments and the early detection. Of course, we're going to look at the impact of quality of life for persons living with glaucoma. And here we have the health psychologist just going to give us a theoretical approach from a psychological perspective on the disease and how it is we can treat it and, of course, cope with it. Miss Astra Dubissette, welcome, and how are you this evening?
I'm good. Good evening.
Wonderful. Good evening to you. And from a psychological perspective, in terms of glaucoma, you have seen a lot of patients with this condition and this disease at Clear Vision Eye Center. And of course, we have seen the statistics. Dr. Julien has treated, Dr. Singh would have identified some of these patients. And of course, coping with the condition is something that most persons tend to have a difficulty with. So from your perspective, break it down for persons who are here, listening. Tell them what it is to get therapy. What can you do to seek to get therapy?
Okay, so the first thing, usually when you hear a diagnosis, you panic and you freak out. But the best way to adjust and to cope with a diagnosis is to learn more about it.
Yes.
So asking as many questions as you can to your opthal or your optometrist or even a health psychologist can help you understand exactly what's going on and what you can do to cope with the situation and maintain and comply with what you need to do to manage your diagnosis.
Right.
So a lot of research has shown that most people, they don't comply very well because of how they psychologically react to the situation.
Yes.
So if you don't want to really acceptance is an important thing. If you don't accept that you do have an issue that needs to be addressed, managed, and taken care of properly, most people will not comply to the advice of their doctors. And that's one major problem. So being able to accept and not deny the fact that there is something going on, because like the doctor said, with open angle glaucoma, you don't get any symptoms. It just happens when it's already bad.
Yeah.
And most times when you cannot see what's going on, feel what's going on, or have any physical evidence that, whoa, something's happening, people don't pay attention to it. And that's where things go bad.
Right.
So with speaking to your doctor, taking things slowly, and actually figuring out, okay, how can I adjust what I'm doing now to make this better will help.
Yes.
So that will decrease your fears, but also put you in a position to be empowered to say, okay, I can take control of this without it getting bad, because it's progressive, so it can be slowed down once you learn earlier.
Right.
And for those who learn about it late, having a good support system, which is the same thing with your family. So family and friends, their understanding of the condition will help you be able to cope with it better.
Correct.
Yeah.
And Ms. Astra Dubissette, I thank you so much for this explanation, because it's true. Persons here in Grenada, most of them with glaucoma, they don't have what we say in Creole, it takes a village to raise a child. So most people don't have that village to help you when you have that diagnosis, to help them with the administration of the eye drops, to even cope with them with days when they are unable to see, unable to move around, and unable to get stuff. So for persons like that, what else? What are the possible, therapy sessions or possible places they can go to gain help for that if they don't have that physical support at home? Okay,
so if you speak to your doctors or a psychologist, they will give you what we call interventions to help you address and stay on top of things.
Right.
So, for example, you have a drop schedule.
Yes.
These phones these days have apps that actually remind you when to take your eye drops.
Right.
But then again, you have to be obedient. It will say drops time, but you can't ignore it. You have to do it.
Yes.
Right? So there's technology that can help you, different apps. You can, for example, family. You may be able to explain to your family member what's happening, and it's good when family work together to help somebody.
Yes.
Although it could be overwhelming, like people need to remember, do not push the person, because that will be overwhelming to them because they're already dealing with it.
Right.
Sometimes they may not be handling it well. So gentle prodding, I would say, will help. So, like your 70-year-old dad that's stubborn mightn't want to hear he has to take his drops.
Right.
Sometimes you may have to do a little rough question. So you don't want to see your grandchildren grow up? Things like this to kind of hit home, but in a gentle nudge that they'll say, okay, let me take my drops because I do want to see my grandchildren, or I do want to be able to still bathe myself, things like that.
Yeah.
Because with your sight, you have your independence.
Right.
Without your sight, you lose part of your independence.
Right.
And this is something that's hard for some people to accept.
Great.
So with helping them understand, okay, this is more than just listening to the doctor. It's my duty to actually do something about it.
Right.
Because it takes everybody to work together. The doctor does their job, to make sure you understand what's wrong. They give you the medication. It's now your job to make sure you listen, take the medication, and then with the help of your family, they will remind you, go to sessions with you, so you don't feel alone that you're dealing with this by yourself.
Right.
So that's why it's good to have a good support system. That way, in moments when you do feel overwhelmed, for example, if you go and you see, okay, my eye pressure has increased and I feel overwhelmed, oh my God, I'm going to go blind.
Right.
But not that you're going blind, you just have a reading today that's just not so good.
Yes.
With a good support system, they could talk to you to say, calm down, okay, this time wasn't so good, but let's see if we can work together, that I can remind you to take your drops, do your visits regularly, get your eye pressure taken frequently, and then that will help you get back into the mode of compliance and proper eye maintenance.
Excellent. And that is an excellent explanation again, Ms. Astra Dubissette. But of course, in terms of retail and from supporting as Clear Vision Eye Center and representing as Clear Vision Eye Center Limited, in terms of retail, what do you think we can tell our customers who tend to have panic, or we say panic episodes when their eye pressure fluctuates, and you just said that, what do you think we can do in that event? How can we cope with them and tell them it's okay? Because sometimes the eye pressure readings will fluctuate based on the administration of the eye drop. Because you know some of them don't comply, as you see in most times when they do come in the office, right? So what else can we do to help them, you know, to reduce that kind of panic episodes they often tend to have?
So, like I said, conversation is important. So once you speak to them and you understand, okay, get on a level with them that they don't feel like this is the doctor and this is the patient. More like, all right, let's meet midway.
Yes.
And let's talk. What are you doing when you get home? How busy are you? Because sometimes people get busy and they genuinely forget. It's not like they neglect that they need to take their drops.
Right.
So you get down and you probably get to understanding what their schedule is like, and maybe work with them to say, okay, maybe lunchtime might be a better time for you to put your drops in because that's the slow moment you have.
Right.
Then when you get home in the afternoon, you wash your hands, do a drop again. Or like in the morning when you wake up, before you do any, like get ready for work, put your drops in.
Right.
So like you schedule based on their schedule. So that will help, because if you have a person who works 8 to 4, their drop schedule might be different to somebody working night shifts.
Right.
So you have to like talking to them, understanding what their schedule is like, would be able to help them schedule things like that better. But it's very important to have conversation with your doctor.
Right.
So your doctor is actually a friend in this.
Yes. Yes.
Yeah, some people think, okay, I'm wasting their time, I'm taking up time, but the best way for them to help you is you to slow down and tell them all your questions and all your concerns.
Then you build a rapport, so you get to learn your patient very well. And I love the explanation you did in terms of understanding their schedule and when they can administer the eye drop. So I'm going to turn to Dr. Julien to ask a question real quick. Is it that we have to stick to the actual time of taking the eye drops, or we can, like Ms. Astra Dubissette suggested, from a psychological perspective, we can go with the patient's scheduling? Dr. Julien.
Right. So one of the most important reason for neglecting treatment or not doing a good effective treatment regime relies on the fact of compliance. That is key. So the aiding of having a schedule and having the alarms have always been a very good approach. But also, there was a patient at a time, and he was given an 8-hour schedule. And no matter what he did, he was not able to keep up with the every 8 hours. So sometimes you just have to be creative. So we said to him, how about you do it breakfast, lunch, and supper? Can you do it?
Right.
And he was very disciplined. He got wonderful control of it in his intraocular pressure, doing it around his meals.
Right.
Breakfast, lunch, dinner, and then he had that under control. Another issue for the patients has been having a reaction. So it's very important that you have that discussion, because as drugs, as eye drops, they would all have reactions. So sometimes you might have a burning sensation, tingling, redness, swelling, itching when you apply a particular eye drop, it's not because the eye drop is bad or something is wrong with it. It's simply because your eye is reacting to that drop. It may be because of a baseline ingredient, the preservative in that drop called benzalkonium chloride, or it can be just that ingredient is not well tolerated by your eye, but is tolerated, for example, by Astra's eye. So it's about going back to your doctor, say, hey, I tried with that COSOP that you gave. I did it. Every time I instilled it, it was just too terrible. So we say, okay, let's go back to the drawing board. So we're going to change your treatment regime. We're going to change you for a different eye drop like Alphagan, which has a good neuroprotector component. It can be used twice a day, 3 times a day based on the pressure. So remember the scheduling of the drops and the type of the drops and the frequency as well as the quantity of the eye drop varies from person to person. So if I have a very low threshold, so I know your intraocular pressure is only over by 2 points, you may just be started on a 1 drug therapy. If it is that you have a higher range, that you know 1 drug is definitely not going to get adequate control, you add an adjunct. Right? So sometimes you may find a patient is on 3 eye drops. It's because your glaucoma is very advanced. It's bad. You have progressive damage to your nerve. You may have a 85% damage already existing. So you need a tighter control of your eye pressure. So you cannot afford to have your pressure be 40 because the little remaining optic nerve fibers that are alive will die. And when these fibers die, you lose sight. So it's very important you try to stick to the schedule given. But of course, if you have any adverse reaction, you liaise with your doctor, you explain it, and you can switch around therapies to get the best control for you. And there are a special group of persons that have allergies to all type of eye drops. It's a difficult group.